Yeah,
Perfect.
exactly.
I was reading about the superintendent, I thought maybe you'd throw your name in the hat for taking over there.
He actually said, well, because one of the board members asked him to come back.
Get the band back together.
I believe reasonably well.
Well, if he goes, you gotta go with him.
Well, I'm not sure about that. Well, brought down enough time in the year.
All right. This time I'd like to call the meeting to order. This time I'd like to call the February 19th, 2025 meeting of the Board of Health to order. First item on the agenda was the roll call. Jenny, would you call roll, please?
Dr. Harding.
Here.
Dr. Hayes,
Here.
Dr. Lindenman,
Here.
Mr. Lynn,
Here.
Ms. Rylander,
Here.
Ms. Van Rainey,
Here.
and Ms. Vincent.
Thank you very much. We have a quorum. Next item on the agenda is the adoption of the agenda. So everybody's hopefully had a chance to review the agenda, entertain a motion. This time.
I move to adopt the agenda.
Second.
We have a motion and a second. Any discussion on the agenda? Hearing none, all those in favor, please say aye.
Aye.
Opposed, say nay. Motion carries. Next item on the agenda, approval of the minutes. So everybody's had the minutes for a few days and hopefully you've had a chance to review them. Any questions or comments, or if not, I'll entertain a motion.
I move to approve the January minutes as presented.
Second.
We have a motion and a second. Any further discussion on the minutes or questions, comments? Hearing none, all those in favor, please say aye.
Aye.
Opposed, say nay. Motion carries. Next item on the agenda, board president announcements. Just a quick plug to please reach out to your state representatives and state senators on the Health First Indiana funding. Looks like we're going to take a little bit of a hit right now, down from what, 150 to 100 million is currently proposed, but everything's on the table. So we just got to keep pressure on to make sure they understand what a good investment those funds are to the health and well-being of our state. Next item on the agenda, health officer presentation and report. Dr. Migliori.
Thank you, everybody. It's pretty self-explanatory. The packet's kind of big this month. Sorry about that. The numbers are up for many of the services that we're providing. The lead testing is up. It's about 2 months behind because those results are reported downstate and then they're shared with us because providers in the community are giving those results to states, labs are giving those results to states, and so to the state, and so we rely on them to transmit that information back to us. But they've been busy with lead follow-ups in terms of case management and monitoring. Our CHWs are helping with those in the field, doing home visits. Our environmental team are helping with assessments and mediation. So the lead program is full force because we have such a well-admired lead program in St. Joe County. We have been asked to represent that particular program at the State Health Day on March the 12th down at the State House. So the coordinator for the lead program, Michaela, will be going down for the day to represent our lead program, display it, show them what we've been doing and answer questions. I want to put a plug in for environmental for the radon program that has been booming. It's been great. They have handed out a bazillion, it feels like, kits and helping people get remediation. And it's really a great thing, and people appreciate the opportunity to get the free radon testing. The other thing is we did have a small group of us present a CME program last Wednesday at Beacon Hospital, Memorial Hospital, in the auditorium to staff at Beacon about what the health department is doing, what programs we're working on. We talked about the lead program, the radon program, and our immunization program as well. So that was, and also our care program with the EMBER, emphasis on the EMBER program. And so it was nice to get out into the medical community and get our word out. We'll be presenting a similar program at St. Joe Health System in March, on March 12th in the morning. So we're trying to get out there and network and make sure that we can help our community partners and also let people know what we're doing here in the health department.
Very good. Thank you. Any questions or comments for
well,
Dr. McLeary?
First of all, I was curious, if you could tell us a little more about what the state health day is at the State House. What is that for? Who is that targeting?
It's
And-
for local health departments to show up and make their presence known for the legislatures, talk to state legislators, and also it gives the opportunity for local health departments to have a spotlight on programming that they're doing. So the legislatures and their staff can come through and kind of see what everybody's doing. But it's a way of talking to our legislators and showing them what kind of programming we have.
Do we have any others going down for that?
No, just the lead program. But we're the only program in this state for radon. We're the only county in the entire state of Indiana. Indiana is a high-risk state because 1 in 4 homes test positive for radon, whereas nationwide, the average is 1 in 15. So it's a leading cause of lung cancer in non-smokers.
So is the environmental unit representative who's going down to talk about lead also going to bring up the radon is it a kind of a combined presentation, or is it focused just on lead?
The state just asked us to, they really like our lead program. So that's what they wanted to be the spotlight.
Are we sending, is anybody going to be there to tell the story of how the Health First Indiana funds have been used and what a great program that is?
We're going to send Michaela's going to take someone down with her to promote that as well.
Is there any information flyers on that
The State Health Day or?
no, on how to let the representatives know that the funds are being well used and they're effective?
No, but we encourage, I know that we have met with all of our legislators and let them know, but also encourage people to write because it's really important to keep the funding coming.
Is that something that we can get out word on like social media?
Yeah, we can do that actually, and we can also put it on our webpage, but Matt is our social media person and he can get the word out on all of our social media accounts.
So.
That's a good idea.
Any other questions or comments?
I was also curious about in the school health liaison and the $50,000 grant. How to what extent are schools taking advantage of that right now? How much money?
Yeah,
I guess we'll get an
I
update.
had the same question because it said 30 out of 100 so far have been just contacted, and I wasn't sure if that was for 2025. And then it says 65 schools contacted. And they're, does that mean like 35 of them were not contacted, or like, give us an update?
I would be happy to give you an update. Ashley Hellman, Director of Nursing / School Health Liaison. And so the funding and the program, we started fulfilling requests as of the first of the year. And so that's where you're seeing those numbers. Every school has been contacted. So schools that we had no contact with, those are the ones that you see we reached out to them just to make sure that everybody is using the funding. We have seen a pickup in the use of the funding, especially with, things changing and being a little unpredictable right now. So people are wanting to use that funding up. But we had told them, and I still continue to tell them, that the funding is solid, that they have until the end of the year to use it, that they should communicate with the people in their schools so that they're using it in the best way possible for all students. And we have receive. So we're keeping a red cap, asking people to submit information about their time saved. And so I didn't count the amount of time, but we have over 30 submissions from schools, which is great because sometimes it's hard for school health to people to take time out of their day. And so our request to them was just to at least monthly update that and let us know. So we are getting information that it is saving school and class time. And so the program is doing what we hoped it would do. And we're excited for schools to continue to utilize it.
And what do schools tend to be using the money toward? Is it certain items or is it really just across the board?
So I went through and looked at every single item when I was working on our annual report, just to kind of see really the most common requests for the fair funding are for clothing items, pants, and I think we've talked before that pants are expensive. And so we don't get them donated as much. And so we had schools on waiting lists for pants, but we've seen a lot of people requesting pants. And then outside of that, it's just across the board, depends on the school. So all of the categories have been utilized well, but most, I would say, frequently are clothing.
Are the parochial schools, do you find that they're actually utilizing the funds as well?
Yes, yes. And those were some of the schools that we reached out to directly. They do have a few nurses that oversee multiple schools, but we found that the message wasn't getting to the individual schools. And when we saw that they weren't utilizing the funding, they weren't asking questions, we thought, okay, we need to actually make sure that we are sitting down and talking with them one-on-one so they know that this is available and that they're using it. We want every school to use it. Our goal would be, that every cent is spent by the end of the school year.
And so, and I think I was talking with Michelle about this earlier, and this was a good clarification for me, is that we do have some money from Health First that we use to send out materials, things.
Like
that-
AEDs
Yes,
and equipment, medical equipment.
yes, but that's more big ticket items, the AEDs, medical cots,
Those
blood pressure cots.
Yes, those are health-related items that we as a health department can provide. The other items are from our community partner program,
Yes.
which were those items that we saw there was a big need for, but our very generous community was like, how can we help? And so we put those two things together, and
Yeah.
that's where those are coming from.
Yeah, and so those smaller items like toothpaste, and that's really, we're really relying on the community and just acting as a conduit from the community to.
Yes,
And so,
exactly.
and this monetary donation is really part of that,
Yes.
that aspect of the
Yes.
process.
When the program was released, our wonderful communications director, Matt Gotch, had some media about the program, and John Fair heard about it. And that's how,
Yeah.
that funding came to be.
Yeah. Well, it takes care of those clothing needs too.
Yes.
Yes.
Yes, very much. Thank you, guys.
Thank you. Any other questions for Dr. McGee?
One other question that I may have missed this somewhere. Remember how we used to have the maternal child committee that reviewed the fetal demises? Do we still have that?
Yes, we have FEMUR, which is the Fetal Infant Mortality Committee, and then we have the Child Mortality Committee, and we also have the Substance Abuse Suicide Committee. So we have three of those that partner with community, first responders, coroner's office, DCS. So those committees usually meet once every 2 months.
Okay, I just don't remember hearing anything, and I was like,
We-
whatever happened? to
We still
those?
do it. Yeah, we don't have the FEMUR grant, but we do have representation on the committee that we participate with.
Okay.
And one other thing I wanted to bring up was that our Vector program has been invited to speak to the St. Joseph County Medical Society. So in, I believe, April, Brett will be doing a presentation on Lyme disease. So, and we're doing some presentations at local high schools about health careers, evening programs for like the National Honor Society. So we're getting out in the community to be the face of the health department.
I do have actually two questions, and one of them was the vector. I just saw in the report, it said that there was a 32% decrease in Indiana State Department of Health submissions for review, but then we had like a 1,400% increase in inspections. Why is that? Brett? Are we required to do so many submissions? Like, what do we? Because it was just such a big drop.
All right. Bear with me for a moment while I pull up the data. I don't want to speak out of hand. What it's in particular were your question?
It said that there was a 32.65% decrease in Indiana State Department of Health submissions for review. And then it said that there was a 1,444.83% increase in inspections. So I wasn't sure. It seems like that's a huge drop. Like are we required to give them certain amounts of a percent from our vector program? Like, cause we're doing so much. I just wondered why there was a drop.
So the part of the drop was there were less mosquitoes to collect due to our control efforts. Our numbers were down 30% countywide. So there were less to send in for review. Part of that was because we had done 1,000% more inspections going out there and doing those treatments.
Yeah.
That's largely I would say that pretty much accounts for it.
Got it. And that makes sense. And then you, do we have a certain percent that we have to submit to them?
We don't have a certain percent that we have to submit to them. We do run our own West Nile virus tests in-house. When the mosquitoes that are sent down to the State Department of Health are tested for West Nile, Tripoli, La Crosse, and St. Louis encephalitis. But it's a
stuff
2-week
that-
it's a 2-week turnaround time to get something from them. And so running them in-house allows us to have a 24-hour turnaround time from finding a problem and fixing the problem. So the stuff that's sent to IDOH is largely either confirmatory testing or for certain sites where we want to have specific Tripoli testing done.
Got it. Got it. Perfect. And I don't know if you're the person to ask this too. I have one environmental health question. Is that? Are you
It
part of
depends on what you're asking.
Okay. Well, there was a bunch of stuff listed. It had like sewer, water, motel, and then it said other, and there wasn't very much in any of those other categories, but then the other was like 86.99%, but doesn't say what other is. That just anything that doesn't fall in the other categories.
You know what page you're
I
referencing?
don't know because
Is it part of the annual report or is it part
it
of?
is.
Okay,
yeah.
the annual report
Well, the health officer's report.
or
Yeah.
the monthly report. Okay.
Yeah, I don't, it's.
I'm not sure. I think she's saying that it's environmental. It may be in the
There was a
annual.
big huge numbers on my one that I had, so I was like,
Yeah.
Is it- I'm looking for it. We found all these numbers, let's see.
But this is one of the,
It's in the number, this list of number things, sorry, Ken, but.
I think it may be annual report.
Oh, shoot. I don't know, it's under, it's an environmental health, it's the
I think it's
category.
this. Maybe,
Is-
I'm guessing.
no, this
I
is
don't know
the
where
annual
she's
report.
saying
Was it this?
inspections. Find out which one it is, but I'm guessing.
This is the only thing
she's saying
chart.
Yes, it is, you know what,
Okay.
that's different, okay.
It is the
annual
annual
report.
report.
It's the annual report, so never mind, that's different.
Okay.
Well, like, we're not talking about that yet, right?
But we will.
We will, so if
Okay.
you want to ask.
If
your
you want to
question
answer,
now.
Oh,
ask it now.
Here, this is what you're referring to.
Is it under which
there.
category?
It's just environmental health, and then it's under,
Which program?
the complaints, investigations. There's like garbage, food, waste, sewage, water, motels, housing, burning, and then other. And all the ones I just said went down, and then the other went way up. So I just didn't know
Page 18 of the
what
report.
changed in that. I should have printed that off. It was just like somebody.
I really don't think there was much of a change. I think it's just the way we're reporting and tracking these. We changed some of our categories around.
Okay.
And so these complaints would all be stuff that's occurring outside, so they could be follow-up inspections. And that's usually, so if we have someone living in a tent or camper, we may end up going out there 3 or 4 times before we're finally get it resolved, or Marcel takes them to court for us. But that's typically what falls in that category.
Okay, I just wasn't sure what other was, and not, because the other things all went down, and I was like, why did that one go all up? So just
Yeah.
moving around categories, got it.
The state is having a lot more of a more detailed reporting system. So
Got it.
Any other questions on the health officer's report? Hearing none, I'll entertain a motion to approve.
I motion to accept the health officer's report.
Second.
We have a motion and a second. Any further discussion? Hearing none, all those in favor, please say aye.
Aye.
Opposed, say nay. Motion carries. Thank you, Dr. McGlory. Next item on the agenda, new business category, item 25-09, job description, Assistant Director of Finance.
the purpose of this budget neutral job description or job category is that whether we like it or not, eventually in the next, hopefully several years, Amy Rupi will retire. And we're thinking it's going to take, no. We're thinking it's going to take a monumental amount of time for her to train somebody just from the standpoint of all of her knowledge. And so this is in anticipation of that eventuality. Basically, this person would be learning what Amy does. Amy has so much PTO time built up that she has every Friday off during the year. And there are other people that are taking every Monday off during the year just because they have so much PTO built up to burn off. So we think that this is the time to try and get somebody onboarding and learning her position. That's the honest truth. But they would help also with payroll, and we're trying to improve our efficiency in capturing revenue from the nursing department. Our current software only will bill one insurance, the primary insurance. It will not bill a secondary insurance. So there's lost revenue in terms of that billing, and we're trying to capture as much as possible in terms of revenue in the nursing department. We previously did have a biller, a part-time biller, and no, we couldn't find anybody to replace that position. And so this is just also making sure that we can capture revenue that we're losing.
Sounds good. Any questions for Dr. McGlory? Yes.
Would assume there would be a position description.
I'm sorry, did you not get it?
Yep, it's in here.
I just have one question about, so it says billing specialist. But in the requirements, for job requirements, there's not a billing coding requirement. And that's like an entirely separate degree, like anyone that does medical stuff, it's like its own animal.
Yeah,
So I just worry that, and I know that'd probably be hard to find someone to fill that, but it's like, I feel like there should be something written in there that it's preferential even that they have a billing coding training?
I think that's correct. We would, if they don't have it, for sure, we're going to get them training in it because you have to have that training.
Yeah, it's its own animal.
Right. It is its own animal. Absolutely. So thank you for pointing that out because that is our intention. If we don't find somebody who has that acumen, then we will certainly provide that training for them.
Yeah, maybe put that in there.
Okay.
Because I mean, I know if someone was looking at the job and saw billing, but they'd be like, I can't do that.
Yeah.
You know, if they're smart, they'll say I can't do it. And then that, and just put that they are going to be taught. They'll
Yes.
be certified or whatever.
Right.
That'll just.
They
help
have to be
you- It'll
certified.
help you draw people in, I feel like, if you tell them that. So.
Okay. Thank you for pointing that out because that is important.
Do we have to make a motion to amend the job description to add that? Pardon?
Yes.
Okay, I will so move to add what Kristen suggests. That's about all. I-
Billing specialist, a trained billing specialist.
Prefer a trained billing specialist, and if training, if not trained, training will be provided or something like that.
Right.
So that they understand that's a big part of their job, because it seemed like it was in the description.
It is.
Long motion. So your motion is to approve the position description.
And add the
Add.
recommendation for prefer, and if not, we'll train or whatever. So I'll second it since she did.
Is that your motion?
It is.
Okay.
It is.
We have a motion and a second.
She took the words out of my mouth.
Any further discussion? Hearing none, all those in favor, please say aye.
Aye.
Opposed, say nay. All right, motion carries. Thank you. Next item, 29-10. 2024 St. Joe County Health Department, Department of Health Annual Report. Everybody hopefully has had a chance to take a look at it.
You can see that the department has been busy. They are incredibly passionate and talented and it's amazing the work that they're doing. Every single unit is doing it.
Is this something that is available to the public? This whole, like, is it on our Facebook?
It'll be on
link
our
or-
website.
Okay.
It'll be
Yeah.
published on our website.
Oh,
There
super
may be
cool.
a few things that we still need to modify. I believe on page 5, it was suggested that under the lead that, and I need to just talk to the lead team about this, but the last sentence, preventing tenants from being exposed to, instead of unsafe work practices in home, to lead-based paint or something in the environment, because usually the tenants aren't there working. Oh, well, they are, but not for somebody. So we're going to make that modification, but that was our only main modification, unless you have others.
As part of our non-exposure to hazardous things, is asbestos listed in there somewhere? Like, meaning remodels, there's a lot of asbestos in old tile, and do we have anything that we do with that?
Let me ask Mark. Asbestos? No.
We just refer people.
Yeah.
To the what?
Lab.
The lab. Oh, for testing the tile?
The state of Indiana, or IDEM, regulates asbestos and asbestos contractors. So we really don't get involved with it, and we do receive complaints or a lot of inquiries, and we refer them to ECM, Environmental Laboratories, and they do all the testing.
It would, I think that it might not be a bad idea, though, to do something where people understand where and when timeframe wise that they should be watching for asbestos. For example, my nurse just ripped her whole floor up in her house, and she's like, oh, there was 5 layers, and she's showing me the towel, and I go, that probably has asbestos in it. And she's like, it does. So she had no clue. So I feel like if we just put an educational snippet, not that we're going to mediate it, but that we could make sure people know, like, don't rip your floor up without thinking when you're past this age of home, that, might want to think about that.
Yeah, we had that happen on the 9th floor when they were doing some remodeling and they tore a bunch of flooring out. Didn't curtain anything off, didn't protect any of the staff and just went ahead
Yeah.
and
Yeah.
got it
whoops.
everywhere.
Mhm. So,
Could, I don't know, are you thinking along the lines of like a link on the website to maybe the state?
yeah,
The item, or
yeah.
if you have, before you,
and just kind of
Information on asbestos.
rip your house up, or, just some catchy line that
Yeah.
people will be educated. Because if you're not in construction, people don't think that about that at all.
don't flop if you're flipping. I mean, that's really
I
a
mean,
bad
be like,
thing.
what? And
That could
you
be a
know,
cable TV show.
Yeah, it could be.
Yeah, that'd be a good cable TV show.
Asbestos everywhere.
But since we're the health department worried about health, and it'd be good to educate people on
Educating
that
public,
component.
yeah.
So kind of goes with lead a little bit because it's toxic.
So our mission on this item is to approve this report.
Yes, and
um,
so that then we will present it to the commissioners.
okay, and then it has to go to the state by a certain date.
Yes.
So,
I have just literally copy edits. So
Okay.
nothing substantive, and I can show anybody if they want to see. But I was just going to give that to you afterward.
Perfect. That's
It's
perfect.
Where I think we need commas and things like that.
Okay.
So I'm assuming that we can approve and I can still get my comments in the right spots, right? Okay, thank you.
any other questions or comments on the report? All right, hearing none, I'll entertain a motion.
I make a motion to accept the annual report.
Second.
We have a motion and a second. Any further discussion?
Are we accepting with with
With the comment.
Ellen's commas added? Yeah.
Ellen's comments.
That wasn't in the
Yeah.
motion.
Editorial.
I
Yeah.
will make a motion to accept the health annual report with the
edits.
edits
With,
Or-
with
Grammatical
any
edits.
Grammatical edits.
for grammatical errors.
I already had one motion on the table and
Yeah,
seconded.
Second.
Now we can't have two motions on
Yeah.
the table at once.
I think she,
She rescinded her original one.
Replace it with
I did,
update-
that's what I did.
We have an updated second then from somebody. Yes?
Yes.
Okay. We have a motion and a second. Any further discussion? Hearing none. All of those in favor, please say aye.
I,
Opposed, say nay. Motion carries. Thank you. Grant request, item 25-11, discussion and vote to apply for PHEP.
Oh, yeah, that's right.
We have received paperwork for the next grant cycle of the FEP grant, which is a Public Health Emergency Preparedness Grant. It runs July 1st through June 30th, and the amount that we have gotten in years past, and I'm assuming it's going to stay the same, is $25,000. What we used it for this past grant cycle was for salary recovery for our Public Health Emergency Preparedness Coordinator. And then we had some funds set aside in HFI for services and supplies that he would need to perform his job duties.
and we're planning to use the money for basically the same thing this coming year?
Actually, I don't know. Cameron filled out the form. I don't know if that, I think Mike was supposed to present. He went home sick. So I apologize that I don't know if that is going to be the same use of funds. If it's not going to be used for salary recovery as it was this year, we would use it for the services and supplies that we currently are using HFI for.
Okay.
Yeah, I mean, it states in here, the funding will be used for training, supplies and or planning.
Yeah, so we'll go back to using the FEP grant for supplies and services.
Is this a competitive grant or is it a grant that if we apply for it, we usually get it?
It's not competitive.
It's a letter of intent. We just receive information from the State Department of Health, and as long as our coordinator completes the deliverables, we stay compliant with the grant.
Okay.
Thank you. Any further discussion or questions or?
I would love to hear of, not today, you don't probably even know all this, but I would love to hear what exactly we purchase and have for emergency preparedness, What do we?
Some of the things he purchased last year that he would give out at health fairs were first aid kits, flashlights, things that, sunscreen, basically it's weather type emergencies. We gave out, believe it or not, some weather radios, small ones that were inexpensive, sunscreen, mosquito repellent. So a variety of things to, and maybe in an emergency that you might need. He is looking at some other programming, some, potentially some bike helmets in the community for, disadvantaged children. I know he's looking into that this year, but we've also talked about doing a mass CPR training event for 8th graders. So there's things that are sort of in the pipeline, but it's things besides being prepared for a public emergency, some sort of horrible natural disaster, making sure that you have stations where you can set up, people can get medicines, they can get treatment care. He's working on coordination for that. But also things that you just don't think about that you take for granted, the first aid kits, that sort of thing.
Cause like for, obviously we've had a lot of disaster things happen in this country in the last year. So do we have cause when you're waiting for the US government to come in, your local government, i.e. us, the health department is who people are going to turn to. Do we have?
We do. We have, in fact, we've gone through a couple of drills already. We have a call down tree, but we have a pod. They're called pods where you set up, and our designated pod is at the Century Center. And so we do have partners in the community, and we do have contingency plans for emergencies.
supplies and-
He's worked with the local EMA too. So it's a very tight-knit group, and they do talk a lot and plan a lot. They meet regularly, and he's a part of that planning.
There's a county agency.
The emergency agency, yeah,
Right. the
That
health
we work
department
with?
That we work with. that we're
Okay.
part of.
right. And they have regular meetings,
Okay, good. Yeah.
hoping the other shoe doesn't drop. That's,
Well, it's, if you're ready, it doesn't, but if you're not, then I don't know. I don't want to tell somebody they can't have water for their kid and stuff like that,
Cameron is ready.
Good.
All right. Can we get a motion on this item?
I make a motion to approve the FEP grant.
Second.
We have a motion and a second. Any further discussion? Hearing none. All those in favor, please say aye.
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 Opposed, say nay. Motion carries. Next item on the agenda, item 25-12, discussion and vote to apply for
Naloxone, Narcan.
Narcan grant kit opportunity.
Renata Williams, Director of Care Unit, second floor law building. We are seeking approval to reapply for the grant for the physical doses of Narcan through IDOH. There is no money attached. They will issue up to 6,000 doses each grant cycle for the local public health departments to be able to distribute this in the community.
Thank you. Any questions?
Do we get 6,000 doses?
So we have just about used up 6,000 doses. So the health promotion specialist was telling me, since we have to go through a process to get approved, that it's about time to start that process so that we have enough. There is a clause within the grant instructions that says if you go over 6,000, they will work with you depending on the data that they have and how many overdoses to get some more. So, yeah.
Thank you. If there's no other comments or questions, I'll entertain a motion.
I'll move to accept the naloxone grant.
Second.
We have a motion and a second. Any further discussion? Hearing none. All those in favor, please say aye.
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 Opposed, say nay. Motion carries. Next item on the agenda is under old business. Item 29-49, discussion and vote, revisions to chapter 117 of the St. Joe County Food Establishments of the St. Joe County Code as tabled.
You recall this was on the agenda last time. It was circulated with the changes. Slightly updated version was circulated again today with some more grammatical changes. It is ready for your approval.
So based on your statement, I presume you reviewed it and you find it acceptable in its form and content.
Yes.
Thank you. Dr. Migliori, any comments or anything?
No,
to
there
add?
were mostly grammatical things, edits. That's what we did.
Any questions or comments from the board?
I couldn't tell if this was a new thing or a old thing. I was looking at your highlighted piece that you sent last month, which I loved, but, so it says that we have to approve a permit for remodels and stuff like that on like, and, is that new or do we always do that? Because I'm like, is that a building department thing and we're doing it too now, or was that old already in there?
Carolyn Smith, Director of Food Services. It is not new. We're not talking about the building plans. We're talking about the plans for the kitchen, food service areas, anything directly related to that. Those plans, when they are extensively remodeled or brand new construction, no matter what the facility, gas station, a new restaurant, public schools, they submit that to us for our review to make sure that those areas will be compliant with what regulations are with regard to food service.
And they do that first and then the building.
They're supposed to.
Got
No, not then department, no, not, the building department will have it and plans approved and whatever, and then they will submit the
Okay.
portion of the food services to our department.
Got it.
Thank you, Carolyn. Any other questions or comments?
I just wanted to thank Carolyn and everybody else who's working on this because it is really tedious to have to go through all of this and make sure that all the i's are dotted and the t's are crossed. And especially because part of what was going on is that you have new like establishment categories of these there are 5 types of establishments now that can get different types of permits. That used to be 3, or you've kind of
Yeah. Yes.
but that meant, and this is why I was so glad that you guys were willing to like check all of this again. It meant that you have to go through every single part of the code every time they talk about an establishment and say, does it apply to this establishment, this establishment, this establishment? Because some apply to only some establishments, some apply to all of them. And it's really tedious and you're reading the same thing over and over again, the same words over and over again. And so it's a grind. So thank you, because hopefully this will be in a good position, especially because you mentioned at another time that apparently there are more revisions coming from this, or changes to the code coming from the state in the near future.
That is correct. This code, the ordinance is 20 years old.
Yes.
And with the update of the food code, there will be term changes, different things but we needed to do this heavy lifting to get these things out of the way, which were overdue, so that in the next month or two, when we get the new code, then it will be easier to incorporate those things. And while I still have the mic, I don't want this to sound like a mutual admiration society kind of thing, but I said it to Ellen privately when we were talking today, and I want to say it also publicly, that I appreciate her heavy lifting. Oftentimes when you're doing something, you're so familiar with it, you know what it's supposed to say, so you need another fresh set of eyes to look at it, to see those things that you missed, or what it means, but someone else doesn't know what it means the way it's written. So I do appreciate, sometimes I grit my teeth, but I do appreciate the time and effort that Ellen, you put in to help us get it right.
Thank you. And I certainly have the outsider perspective because I do not know how this works the way you guys do. So thank you.
Okay.
I have one other question that I just was curious about, and I don't know if you know this or not. But it says that part of the permitting process is we look at the total gross sales. Why do we care
Okay.
about that, I guess? And who does that?
We do. There are some counties that have different formulas or the way they calculate fees. We have, long before I got here 29 years ago, always looked at gross sales as the way we determine what the fees are. And there's a breakdown that, it's not in here, but it could show you, up to like a 0 to $49,000 dollars is $75 permit right now. And it goes up to over $1 million, and that can be 425 for a permit. So that's just the way they determine what fees, how fees are paid.
And we talked about this a little bit before for you. Do you feel like that's okay for you guys? Meaning it's probably the same amount of paperwork, right? But you get paid less when it's not as much gross sales, like $75, and you're spending all this time. And then you spend the same amount of time for a higher sales and you get more money. Do you feel like you get enough? Does that make sense?
I feel we get enough that we can have approved. When you look at, compare our fees to other jurisdictions, other counties, some of our fees are a lot higher. And the work is the work is the work. So a kid screaming and hollering, and it takes 15 or 20 minutes to get that shot, we get the same amount as one who's, I like shots in you. So,
Yeah.
that's, sorry, nursing.
Okay.
Okay.
All right, any other comments or questions on this item? If not, I'll entertain a motion.
Move to approve.
I'll second.
We have a motion and a second. Any further discussion? Hearing none, all those in favor, please say aye.
Aye.
Hi.
Opposed, say nay. Motion carries. Thank you very much. Next item on the agenda is public comment. Benny, do we have anybody on the list? No? Okay, thank you. Next item on the agenda, time and place of our next regular meeting will be March 19th, 2025, 4:30 PM, right here in the 4th floor, council chambers. Next item is adjournment, so we are adjourned.
Sure. Do I need to move?
No. All right, thank you, everybody.
Thank you.
Oh.
That's right.
For Marcel.
What?